Could a single breath into a machine uncover the telltale signs of cancer, finding chemicals in our bodies that show the disease is there?
What we're doing is looking at the chemical fingerprint of your breath. So what we're seeing here are a series of peaks, and these peaks correspond to different chemicals.
Developed in Cambridge, scientists say their technology could work. This is the microchip, programmed to examine our breath for the chemicals that cancer cells produce.
The sniffer chip works a bit like a filter. When you're trying to detect something like lung cancer on your breath, there's specific chemical markers for the disease, but it's mixed in with a bunch of other things, what you've just eaten, if you had a ham and cheese sandwich 5 minutes ago. So our device is able to pull the needle out of the haystack, so find those chemical markers of the disease and ignore everything else in the background.
At Papworth Hospital, they see around 600 patients with cancer every year. There are plans to trial the machine here to see if it can detect cancer early.
To give you some idea, if we can treat early stage lung cancer, there's around about a 75 to 80% chance that we can cure that person in the long term. If they have late stage lung cancer when we first meet them, the chance of curing them in the long term is maybe 5% or less. So it's a very big difference if we can catch people with early stage lung cancer.
If it works, smaller machines could be built for GP surgeries up and down the country. The chip was designed for military use to sniff out chemical weapons. Now, in the medical world, it could not only look for the chemicals that cause cancer, it could look for asthma, tuberculosis, and a variety of other conditions. Clinical trials are planned for later this year. If from our breath it can detect cancer early, potentially, they say, it could save thousands of lives. Mike Cartwright, BBC News, Cambridge.